All right, so we've talked a lot about the importance of food and the brain. You have a new book about this. I have a new bar about this. How do you explain to people that what they eat actually impacts their brain?
Well, I think when it comes to the brain, you've got to think of a couple of things. One is, how healthy is your brain, and how does your food support that? One of the most important elements is your insulin level.
Mm-hmm.
So insulin's one of those hormones that a lot of people get confused about. It is the hormone that tells you whether to store fat or burn fat. So a really important thing for brain health is that your insulin levels are not too high, but also not too low.
Mm-hmm.
So for brain health, one of the things that happens with insulin is that the female brain, especially over the age of 40, starts to falter in its use of glucose. We know that from the research you funded with Lisa Mosconi. And so this is where food really makes a difference. You want to make sure that you've got insulin where it needs to be for brain health.
So we were talking a lot when I was formulating these bars about the importance of whey, for example, for women too, right? Even if you're dairy sensitive, the importance of vitamin D, the importance of Bs. How can people, ashwagandha, MCT, flaxseed. So there's a whole kind of field of medicine now that kind of what you eat actually affects mood, brain health, you're saying hormones, your overall approach in the world, right?
That's right. And I think a lot of people don't connect the dots.
Yeah.
They don't realize that the food they put on their fork has such an impact on their hormone levels, their health, their metabolic flexibility, like whether you're stuck in burning carbs or you can burn fat.
Yeah.
So food really helps you with metabolic flexibility. Some of the things you mentioned, like the MCT oil, it's one of my favorite oils because it helps you feel satisfied for longer, so there's less hunger for 48 hours after you have a dose of MCT.
Yeah.
It's also, it increases ketones, so it can help you with that mental acuity. I love it because it also reduces cravings for alcohol. And we know that alcohol is not always your friend. You know, it's a neurotoxin. It also disrupts estrogen balance, so it's associated with a greater risk of breast cancer. As little as 3 servings a week is associated with a greater risk of breast cancer. So we want to be thinking about, how do the foods that we eat impact our health, our hormones, our brain?
That's so important, because I remember when I started in the Alzheimer's advocacy space, nobody was talking about prevention. Nobody was talking about the lifestyle impact. Nobody was talking about food. And so now we think like, oh my gosh, what we eat really does impact our brains starting at a very early age, and particularly for women when they're perimenopausal and beyond. What you're consuming, it has to be kind of the right amount of fat, the right amount of protein, the right amount of vitamins, and you have to know these numbers yourself. That's kind of when we were talking about MOSH, we were trying to get as many vitamins into it as possible, as many oils into it as possible, but really to jumpstart the conversation that what we eat can perhaps prevent it, or at least several years down the road. We don't have a magic bullet in this space, but your work is also like, I don't want to get it, you have in your family, I have it in my family, so whatever we can do right now, that'll kind of put us in a good place.
Well, that's so essential, and I think you definitely have been a pioneer in this area. And I feel like in some ways medicine has been behind you, like a few steps behind you, right? Because so many physicians, when we go through our medical training, I loved my experience at Harvard Medical School, but I got 30 minutes of nutrition. So we weren't talking about things like healthy fats and what that does to your brain. We weren't talking about how you want to limit the number of carbohydrates that you have, because excess carbs get stored as fat, especially belly fat. And so we're now in this place where I think patients, people can feel really empowered about the choices that they can make, so that they can make a decision between a food such as your bars that is really good for your brain versus something that's not so good.
Exactly. And on World Alzheimer's Day, we wanted to do this because we have Alzheimer's in our family. We both talk about brain health, and we both talk about it in a way that you're empowered over the choices you make, whether you eat food that empowers your brain, whether you live the way that you always talk about, whether you exercise, and you talk about HIIT exercise, whether you prioritize your sleep, whether you prioritize your curiosity, your social engagement, all of these things that we've talked about over the years really put you in a better place to deal with as you age, right?
Definitely. I mean, I think so much about the words of Lisa Mosconi here.
Mm-hmm.
You know, she talks about how Alzheimer's is not a disease of old age.
Mm-hmm.
It's a disease of middle age. Like, it's the choices that we're making now from 40 to 65 that really impacts the risk of a diagnosis much later. And so I think that's so, it gives us a lot of choices, and it gives us many options. You can either make the choices like eating too many carbs, eating too much bread, eating too much pizza and other things that cause inflammation, or you can choose those whole foods, those vegetables, those low carb choices, even considering a ketogenic diet and intermittent fasting that we know is so good for metabolic health and for brain health.
And I love what you're saying there, because at no time did you say, or are we hearing, it's about losing weight. It's about being thin. This is about being healthy. This is about longevity. This is about being brain healthy, physically healthy, and it's not about restricting your calories. It's about putting yourself in the best possible position you can to be as healthy as you can for as long as you can.
Well, that's so powerful, because this isn't about diet culture.
Yeah.
This is about metabolic health. And a lot of people don't realize that your metabolism, like all the biochemical processes that are happening in your body, have so much to do with the foundation of your health. It's key to mental health. It's key to cognitive health.
Yeah.
It's key to, living as long as you can, as well as you can. My hope is to be like my great-grandmother, who came to my wedding, danced shamelessly with every man that was at the wedding. She was 97 years young.
Whoa.
Yeah, she's my idol. That's what I want to do.
Yeah.
She died very peacefully in her sleep at 97, cognitively intact. So that is possible for all of us.
But we have to make healthy choices today. Those choices affect our brains, our moods, our hormones, and our overall life. So thank you, my friend.
You're welcome.